good evening, and welcome back to my channel. As you can see, it's a little different type of setting today. I'm actually here at work, and I decided to jump on and just vent a little. Just a little bit. So, most of you guys don't know, but I work in the clinical laboratory, and unless you've been under a rock, COVID-19 is a thing, and it's affecting a lot of people right now, including healthcare workers. So this isn't about to be about COVID-19. I think we see enough of that on Facebook and oh my gosh, my hair. Have I been walking around like this all day? One second. Much better. So, as you can see on the news, you never know what to believe, but I decided to do a video on what it's like to actually be 8 months pregnant and have to deal with this pandemic virus scare. So, being pregnant, this is not how I expected my pregnancy to be in my 3rd trimester. If some of you aren't pregnant or you don't know, it's pretty different. So, there's no birthing classes, there's no breastfeeding classes, my hospital tour got canceled. They sent out policies, so family's not allowed to visit after you give birth. Only person allowed to be with you is your birthing partner. So for me, it'll be my husband, which this is my first child, and I always pictured my mom would be there, my dad would be waiting for me, and they were willing to fly out from my home state to come and be there, but they can't fly. It's not safe to travel. So it's just me and my husband, which is fine. I love my husband, and I would rather have him there than no one there. So there's that. I know a lot of people who are pregnant, their baby showers got canceled too, which I was lucky enough to do my baby shower around 28 weeks. I flew home. That's before all this happened in the United States, so I was lucky. If I would have waited like I was planning to wait, I would have been in that boat too with a canceled baby shower. My OB-GYN appointments, which my husband has been really great. He's been to almost all of them unless he had to work, or I try to schedule them so he doesn't have to work and he can be with me, but he can't go anymore. They sent out a memo that they prefer that only one person goes, and even at my OB-GYN office, you have to stand 6 feet apart from everyone. In the lobby, there's only enough chairs for 6 people, like only 6 people, and they have to be 6 feet apart, which I am very thankful for. I'm thankful for all of the precautions that people are taking, because this is very serious, and I think people should take it seriously. If I had the chance to stay at home, I would be at home, but as others who are in the healthcare field are essential employees, I don't even know what that means. I don't know who is essential. They can't stay home. So that brings me to my second part, and this is more, I'm asking you guys how you're gonna do it if you are pregnant. When is the line? When being in the healthcare field and being constantly exposed to it, even with the mask, even with the screening, even you can touch a wall and then accidentally touch your face and you have it. When do you step back and decide that my child's more important than my job? And I think that's where I'm at right now. My baby is due in 8 weeks, and am I a bad mom for sticking out and working up until I deliver and possibly exposing her? Because we don't know. We don't know what's going to happen to her, or if anything will happen to her. And it worries me. It worries me that I'm putting my child at risk just so I can make a living. And for you guys who don't know, my husband is also in the medical field. He works for an intensive care unit, so when I don't bring home, he's probably bringing home, and vice versa. We're both exposing each other, if that makes sense. And obviously I take precautions. I wear gloves, I wear a mask, I wipe down my area, but I also deal with the specimens. Soon I will be dealing with the specimens and getting the virus testing. And am I wrong for wanting to say no? Am I wrong for wanting to go and put my foot down and be like, I'm technically immunocompromised and I want to protect me and my baby and I can't do this job anymore? You're like, do I have the right to do that? Because is that selfish? There's people out there who needs this testing, and not saying a lot of medical staff, but a lot of medical staff wants to put themselves first. But we signed up for this. We can't just say, oh, I'm thinking of myself and no one else. And I don't know, like, you can only do so much. The screening can only do so much. They can ask if you've been out of the state, if you have a cough or a fever, but what if you're asymptomatic? Then you're still coming in contact with all these people and potentially spreading it. And I think that's the worst part, because we don't know so much about this. And even limiting people interactions, because when I'm off of work, I go straight home. I don't go anywhere else. I try not to go anywhere else. I might get gas, or if I need food, I might get food. But I just wanted to hop on, and I wanted to get you guys' opinions. So if you're in the healthcare field, leave a comment below and let me know what you're doing. If you're sticking out, if you're still working, if you ask for a modified schedule to work somewhere else with less patient interaction, because I really don't have much. I'm kind of confined in my lab, and it's just me and another scientist, which is fine, but I still am in this setting. I still have to walk outside my lab, like outside my little quarantine space, and potentially be exposed to whatever's out there. And any other day, I will be fine. It's my job, I signed up for it, but for a soon-to-be mom, I feel like I have to worry about my unborn child and how this will affect her, because I can only imagine the guilt if I am exposed and somehow it passes through the placenta and she's born with it and she has respiratory disease and she's in the NICU and it's all my fault. It's a hard pill to swallow, and I need to know if it's the right one for the right reasons, and I'm hoping this kind of dies down by May or soon, so people can go back to their daily lives and go back to work and kids can go back to school. But there's so much uncertainty in the air. I work in the field and I have no idea what's gonna happen. Literally, I get a new email every day about something that's changed, and you just roll with the punches. It's called a fluid movement. Like, you really don't know. You're just on the boat too, and hopefully we all survive. So this was just a quick video, a quick pop-in, and I would like to hear your opinions. I would like to hear what you're doing. Are nurses, are you guys still working? Or did you ask to not have patient interactions? Do you just wear masks? Is that enough? Did you take maternity leave early? So yeah, leave me a comment down below and let me know. And subscribe to my channel too, so we can have more talks about what's going on. Alright guys, that's all I got. Have a good evening.